line and you can start reducing prices.
I understand that concept, but in other words, what we're talking about is getting down the cost of the health care related to those social lifestyles.
Well, in this case, what we're talking about is that right now Social Security is paying money out to deal with the smokers that they have under Social Security. Medicare and Medicaid is doing the same thing. Government state programs for, state employee and retirement programs, they're having to pay out for medical costs related to tobacco. So what we'll be able to do is remove those financial burdens from those budgets, and we'll be able to start reducing the budget, reduce the burdens on state employees, federal employees, Social Security, Medicare, Medicaid. And we could see the $100 billion savings from those programs just from tobacco. If we included, obesity, that would relieve those programs of an additional $150 to $250 billion, depending on whose numbers. And when you add alcohol, it's another $200 billion. Just between those three programs, we can reduce the cost by almost $400 billion.
So what you're saying is that your plan would be somebody buys a pack of cigarettes, pays $5 for it, and let's say the tax is $4 for discussion purposes. So that $4 goes into an account. Of course, that would be multiplied by millions of packs of cigarettes, would go into an account now that would be exclusively organized to deal with those particular lifestyles.
Correct. Basically what we're talking about is a duplication of the auto industry, where if you drive a car, you pay insurance. If you don't own a vehicle and you don't drive one, you don't pay the insurance. That's a lifestyle. And so if you do the same thing with all these other lifestyles, you'll be able to find a similar degree of community efficiencies. You'll be able to remove the burdens of those, both financially and the mandates. In other words, the people are turning to the government saying, you've got to take care of us. And so those mandates have now been privatized, if you will. Looking at our approach, what we've been finding is that we could reduce the government burden both financially and morally, the mandates to take care of these problems, by as much as 50%, while improving services.
Well, we only have 1 minute left. So I just wanted to say that certainly does sound like some fresh looks and new possibilities. And what plan do you have to get this more available to people?
Well, what's really pleasing is to seeing what people's response is. It's that little light bulb going off in their head. If we have enough light bulbs, we'll actually be able to shine some real light, and it will attract more people that way. What we are doing is encouraging people to share the Raghu for Congress on Facebook with their friends. Look at our website, roopa.org. That's ROOPA.org. Of course, donations are a huge help for our humble efforts. And the more people begin to share and discuss, the more the momentum will build for it. We've done the research and study, and now it's time to take it out to the public and let them chip away at it.
Thank you very much.
Aloha.
Time is up.
Need special handling.